In the late 90s, early postoperative capsular block syndrome was a mysterious complication of capsulorhexis, producing myopia and increased intraocular pressure. At that time, we made our first ASCRS Film Festival submission, describing the syndrome and some pathophysiological speculations about it. This film is a tribute to the ASCRS Film Festival in recognition to the major role it has played by stimulating our research and development in the cataract surgery field. We will review some of our contributions to this festival in the past 12 years. Instability of the anterior chamber after occlusion break is still an ongoing challenge kept alive by the fact that improvements in this area push towards reduced incisions, which in turn revive the problem. In this area, we introduced the concept of volume domain surge determination, an approach that is helping industry move forward in this area. We also proposed a blocking and venting system that can totally suppress post-occlusion surge. In the year 2000, we presented a single-handed powered IOL injector in view of the limitations of the bimanual procedure. The controlled single-handed IOL insertion device left a free hand useful to accommodate the lens safely and accurately. 12 years later, we now learn that the industry is moving in the direction of motorized intraocular lens implantation devices. Endocapsular rings are very useful devices for stabilizing an IOL in complicated situations. However, ring implantation can be per se a complicated maneuver, especially into a weakly supported and distorted capsular bag. We illustrated the complexities of ring insertion and proposed an alternative design that reduced the diameter of the ring temporarily, allowing for stress-free insertion, reducing complications. Primitive phaco consoles already provided a basic version of power modulation, up to 15 pulses per second with a fixed duty cycle of 50%. During the past decade, power modulation capabilities were expanded up to 100 pulses per second and with variable duty cycle. Modifications of pulse shape were also introduced. These features were supposed to increase efficiency and reduce heat at the same time. We could demonstrate only marginal benefits after extensive tests compared to the original capabilities of primitive consoles. One of our studies was aimed to illustrate the audience about the efficacy of blunt phaco tips, particularly while dealing with the refractive lens exchange population. A silicone-capped blunt phaco needle was effective to remove the lens with a reduced risk of capsular rupture. Interestingly, a patenting effort revealed prior art from more than 20 years before for both capped and uncapped blunt phaco needles. One of the most controversial aspects of our research was related to the jackhammer versus cavitation debate. Our goal was to clearly identify cavitation, initially using a custom-designed stroboscopic system and later using ultra-high-speed video photography. These systems also allowed for the first slow-motion analysis of phaco tip operation. The most sophisticated tests regarding this matter were performed overseas in Singapore. In this process, we learned how to suppress cavitation using hyperbaric conditions. We were also able to compare phaco efficiency with and without cavitation, concluding that jackhammer effect is the main principle underlying ultrasonic phacoemulsification. New phaco modalities, as well as diverse phaco needle form factors, focused our attention toward the microfluidic events in the surroundings of vibrating phaco probes. We introduced the technique of particle image velocimetry, using microscopic seeds and again also using ultra-high-speed video photography. In this way, we described different microfluidic footprints for torsional and axial phacoemulsification modalities. One barely understood aspect of phacoemulsification is related to the elements that contribute to thermal corneal injuries. Our latest work has dealt with heat production from external friction as well as internal metal friction during ultrasonic probe vibration. Different modalities, such as torsional and longitudinal phaco, exhibit totally different thermal footprints that have been well documented. Finally, laser-assisted cataract surgery and ultrasonic phacoemulsification will both evolve into the future in an unpredictable manner. The ASCRS Film Festival will survive us to teach the future generations about the latest techniques and technologies.